Hi guys, good morning. How are you guys doing today? We're here doing a live with our amazing Dr. Gurani. How are you feeling today? Thank you so much.
I'm doing good.
So we have a couple of questions here, you guys, but if you guys have any questions or any doubts, you guys can put them in the chat and he will be answering it, okay?
Alrighty, let's go.
Let's go. So why is it so important to have a proper BMI for my BBL surgery?
Okay, so one thing about a BMI, just to be clear, I'm not a very big fan of the word BMI or the concept of BMI because it doesn't take into account your muscle and bone and water content. But the bigger the BMI, the bigger the chance that you can have complications. Usually you have a lot more fat that needs to be removed than that is allowed at the outpatient surgery center. So in essence, putting all those concepts aside, also in the state of Florida, the BMI has to be from 40 and below, so that you can be allowed to have the cosmetic procedure in our center as per the rules of the state, and that's just for your overall response to anesthesia and your cardiovascular system and your lungs to be able to tolerate the procedure as an outpatient. So versus a hospital. So I don't like that concept of BMI because it doesn't take into account the distribution of fat. Some people have more central obesity, some people have more peripheral fat deposits, some people have fat under the skin, some people have it intra-abdominal. So it's kind of a very, to me, I find it very annoying because it's not fair across the board to just use a number and not look at everybody's anatomy. So I encourage patients to obviously try to be within the number below 40, but send me your pictures. Send me your photos, your weight, your height, and I can help you achieve your goals.
We have a lot of comments here that say my favorite doctor, literally the best.
Thank you.
So,
I appreciate my loyal following, and I really appreciate the patient referrals. It's very good when you walk into a room and the patient greets you and says, "You worked on my sister, you worked on my mom, you worked on my friend. I'm part of a group in such and such city." So it's very nice. Thank you so much for your support. I really love my community.
So sweet. So we have a question here that says, is it possible to achieve fuller hips and more butt projection with a second round of BBL?
Yeah, for sure. As every time you go under for a second round or even a third round, we can always adjust areas that you were not happy with, or if you needed more, because the skin stretches to a certain extent and then it relaxes, it heals, and there's more flexibility down the line after the first procedure. So yes, we can definitely improve.
So we have a comment here that says, coming in May, I'm so excited for my BBL.
All right, looking forward to seeing you.
Dr. Gurani is the best. He did my surgery 4 years ago and I'm still looking great.
Oh, that's good. That's good to know. That is a testament to the good technique, and knowing somebody, when a patient has lasting results, that means we spread the fat in the right places, we took our time. It's not just sucking it out and dumping it. It's thinking about the healing process, and that's why going to people with less experience, people that are not board certified, people that are just popping up here and there like a jack-in-the-box type of doctor, that is not smart. There is something to be said about consistent results, which I have, and years of experience, and using the scientific method so that you can ensure that the results are predictable and long-lasting.
Of course.
And that's really good to know. Thank you for sharing.
So we have a question here that says, how does the skin get tightened after surgery?
Okay, so every person's skin is different, depending on how much. It depends on genetics first. So everybody has a different background and different quality skin, and within the same racial makeup, there is different types of skin. So anyway, putting that aside, skin will tighten to a certain extent after liposuction, and we have modalities like the J-plasma that can help tightening. We have radio frequency devices. We have ultrasonic energy in the form of Vaser. All of these energy sources help with the remodeling by heating up the skin, and the tissue under the skin can help tighten the skin. Now, some people, by just the act of lipo, shrink enough and the skin retracts enough that they're satisfied, and that is a testament to how good the elastic fibers are. And some people need energy sources that can help with the tightening of the skin. And then ultimately, some individuals are on the other end of the spectrum, and their skin is so damaged and so loose that after the lipo, they really should consider a tummy tuck procedure or a body contouring procedure where they remove excess skin. So not all patients are going to snap back like a rubber band and not need a tummy tuck, and some patients are, like I said, on the other end of the spectrum, and some people fall in the middle. Sometimes it's hard to predict. Sometimes I can give you my intuition based on my experience. And you know, the next question is going to be, do I combine a lipo with a tummy tuck or a BBL with a tummy tuck? And you know that I do not do a BBL with a tummy tuck because I think it's too dangerous operating on the whole body like that. And I know people will say, oh, you know, if I have extra skin, you might as well just cut it off after the lipo, so do the tummy tuck with the BBL, and I think that's dangerous. I think if you're going to have a BBL, you should do that by itself and see what happens to the skin and come back later for the skin removal if you're not happy. Okay?
So we have a question here that says, can I add liposuction on my arms and neck for the BBL?
Yes. If you're doing lipo of the chin, the arms, and we're not having to make a cut on your abdomen, that's fine. That's fine. I mean, this is, the volume of fat here is not that big, but it really helps define the jawline, the arms. I mean, I don't have to explain the arms. You know, the different patients look at themselves in the mirror or when they're wearing a dress and they say excess fat on the arm, and you know, I'll be more than happy to shape the arms for you.
So we have a comment here that says, the bomb at proportional BBLs always match. Can you share more reshapes?
Can I share more reshapes?
Yeah.
Sure. I mean, a lot of patients also disappear, you guys, and we never hear from them, so it's very hard to have pictures, but I will, the next time I have a case where there's a lot of asymmetry, I'll make sure I post. We're trying our best to get as many photos as possible. Remember, a lot of patients don't want to be posted, so I appreciate all the patients that help us with posting, because it does make a difference for the rest of the community that hasn't made up their mind yet, and all the respect to the patients that want their privacy. And we're here very respectful of your privacy. We'll always ask you before if you want to share your photos online, you know, obviously keeping your identity respected and your privacy respected.
And we have a comment here that says, just go look at me, he snatched me up.
Okay, well, share your link. Put a link in there, or share your Instagram or TikTok account, and please help me with future patients, because it doesn't matter what I say or what I post. When a patient is communicating with another patient outside the platform, our platform, that is increases our credibility, because it's word of mouth. That just seals the deal for us, and I appreciate that. Organic leads are the best leads.
Of course. So we have a question here that says, do you combine lipo with breast lift and implant?
Yes. You know, I'm always careful to not put the patient through a lot. I'm careful about not hurting the patient or doing something that's not necessary. But yes, if you come in and you tell me which areas are bothering you, we can definitely, with a breast lift or a breast aug, do areas of lipo where you're going to be satisfied.
Great. So we have a question here that says, do you perform BBL reduction?
Yes, for sure. If you feel like you're over contoured, or maybe after the procedure you're happy with your shape but it looks too big, or you've gained weight, I'd be more than happy to reduce the size and get you to a place where you are more comfortable. We can do that. You can send us pictures, and when you're in person, you can definitely stand in front of a mirror, tell me, hey, this is what I'm thinking, and I'll be more than happy to give you feedback. That has been now lately something that I've noticed. A lot of patients, whether they're mine or from some other doctors, the trend is to go smaller, and I appreciate that. No problem.
So we have a question here that says, how long should I stay in Miami after my mommy makeover, and can I add a vaginoplasty to this procedure?
Two very good questions. Let's address the time. So please, when you come to Miami for a mommy makeover, plan to stay 10 days after surgery. So we ask you to come here the day before surgery so we can see you and get you ready. The day of surgery, we don't count that day because that's not post-operative, that is you going through surgery. So those are 2 days. And then we need you here for 10 days, especially if we're talking about a mommy makeover. There is breast that we have to make sure that the wounds are good there. There might be drains. In the tummy, we have drains, and it's good. It's better for us to manage you for those 10 days than just send you back home real quick, and then it's kind of a crapshoot who's going to be helping you. So please plan on that. Now, the second part of the question: can you combine a vaginoplasty, labioplasty with a mommy makeover? Absolutely, because I don't think the labioplasty or the vaginoplasty are something that are going to impact the amount of surgery. It is not a very big procedure, and the vaginoplasty is internal, so you don't even feel it. The labioplasty is the skin outside, and it's a hidden incision. So yes, you can definitely tolerate that procedure together. Then in a mommy makeover, you're on the operating room table facing up. You're laying on your back, and we don't have to change your position for the labioplasty, vaginoplasty. So I think it's safer than trying to combine a mommy makeover with a BBL. That's what I don't want.
So we have a question here that says, can fibrosis be removed with another surgery?
Not really. It's very difficult. The word fibrosis, guys, is not very well used. What happens is there's two concepts here. There's always a scar when we do lipo. There's no surgery without scar, whether you get a cut on the outside or whether it is a scar from the act of lipo, where we put a cannula and suck fat from under the skin. There's always a scar that's going to be associated with any type of surgery. So we're basically trading scar for a better result. Now, the other aspect of this internal scarring that adds more of a nuisance or annoys the patient is when somebody does not really take the time to get the proper massages. At the beginning, when you're here after the first day, second day, third day, up to about a week, we're kind of pushing fluid out of the incisions, draining all that excess fluid that the body cannot absorb naturally. So what we really recommend is after that period, then we start with the proper lymphatic massage, where the amount of fluid the body is producing is still high, but the lymph nodes are absorbing them, but we have to help direct that fluid to the lymph nodes, which are in the groin or the armpits. So if that's not done over an extended period of time, like up to 2-3 months, you're gonna have a lot of fluid stay in areas that you don't want, and the skin feels rubbery and doughy, and eventually that's what's kind of confused with fibrosis and scarring. And that swelling, we call it edema, becomes it organizes into a thicker scar, and the patients start feeling that leathery feeling. And we can break it up with Vaser. I can try go in again and break up that stuff, but once it sets in, it's difficult to remove. So please pay attention to those early 3 months where you need to make sure that you go to a massage therapist. And then again, you guys have heard me say this many times: get yourself a lotion or body oil and massage yourself. Your hands can reach quite a bit of surface area, definitely the anterior abdomen, definitely the love handles, mid-back. Don't hesitate to massage yourself 2 to 3 times a day on your own, even if you have a very good massage therapist in town that you visit. Okay, it's crucial to do that for the first 3 months non-stop.
We have a question here that says, can you get a massage on the same day of your surgery after?
No. The first post-operative day, the day you go to sleep and wake up, you go home, and the only thing I want you to do is walk and hydrate and eat something. The first day or the first evening after surgery, no. What you do is you go home, you come back the next morning, and that's when we remove the garment and we start with the massage therapy.
We have a question here that says, how many times a week should we get lymphatic massages?
As often as you can afford. As often as you can afford, and I want you to get involved. Use your own 2 hands. Learn from us and apply it on yourself, and then find yourself a massage therapist where you live to help you as well. Or some family members for the areas like the mid to upper back that you can't reach.
So we have 3 questions and
Mhm.
1 question here that says, how long do we have to stay for BBL? What if I fly? Can we sit on the flight? And how long before surgery should we not drink socially?
Okay, so no drinking for a month. So 1 month before surgery, please, no alcohol, no weed, recreational drugs, no diet pills, no supplements other than vitamin C, so and iron. But on the plane, I want you to use a booty pillow that you put very low on the bottom of your thigh, right above your knee. That will help raise your buttocks off the seat, and also invest in a pillow for your back so that you don't fall backwards in the airplane seat. We'll give you a letter before you leave the clinic on your last day here that you can share with a flight attendant on the flight and what's called the gate attendant. Don't bother with the in the front when you're depositing your bags, check-in. That is almost pointless. You want to give that letter to the flight attendant on board the flight and the lady or gentleman that is checking your tickets to board the plane. Those are the people that need to have the information, and we'll provide you with 2 letters. This way you feel like you can have some early communication with them so that they will assist you. Sometimes they want you to sit in the back. You might want to book an extra seat next to you so that you can stand up or spread your body across the seats, or maybe turn around and use your knees to face backwards. So we'll talk to you guys about that. But yes, there's the rules of takeoff and landing. You have to be seated, and if there's any turbulence, you have to sit down. So the booty pillow, a back pillow, and we'll, hopefully the flight won't be as horrible as you think.
So we have a question here that says, for a mommy makeover, do you only remove excess skin or do you also reshape the stomach?
Okay, so what we do is, we look at where the skin excess is. So if you have extra skin above the belly button and below the belly button, that's what qualifies you for a tummy tuck. And what I do is look where the excess is coming from. I have to release the skin from the muscle, cut around the belly button because it stays put in its place, and then we pull all that skin down. Everybody wants the scar to be in the bikini line so that you can hide it with your bikini. And yes, so we have to use geometry and spread the skin along that incision because we only have the luxury of that 2-dimensional incision. And then as we're doing that, you're obviously repairing a muscle if you have to, and adjusting the skin. So if there is unevenness, like we're not necessarily very even to start with. People gain weight differently, skin stretches differently, and so yes, I try to divide the body in 2 halves and try to get landmarks using like the pelvic bone, the belly button, and try to look at the pubic bone and see if I can get as much symmetry as possible across midline so that the eyes can perceive harmony.
Of course. We have a comment here that says 3 years post-op and still love my results, and I had a baby still thanks to Dr. G.
Wonderful, wonderful. So if you're a BBL or a mommy makeover patient, please post your result, especially if you've had a baby after a procedure. That actually is a teaching moment for me as well. I'm learning from you, the patient. A lot of patients don't share their stories, but I really appreciate you telling me that you've had a good result and it lasted before and after the procedure. So please post online, let me know, DM me, and share your experience, because I like learning all the time. It's a very good experience because I can share that with patients, because I get that question: what if I get pregnant? And I feel like if the work is done properly, I think it will last. It will definitely snap back. Like I said earlier in the live, everybody has different skin. Also, the size of the baby can be different. How much weight we gain. So, having that in mind, it's very encouraging to hear that you had a good result before and after the pregnancy.
Great. So we have a question here that says, what are the 12 areas in the Lipo 360 BBL? I have one in 2 weeks.
Okay, wonderful question. So we start from below the breast. The inframammary fold starts here. So think about where the bra line is and down. So from the bra line all the way across the back and down to the waist. It makes sense, right? So if you start from here, then you just draw a line all the way across to the back. So the bra roll is where it starts and go down to the waist.
We have a question here that says, do you go by wish pics?
Listen, the wish pics are a way of communicating. So I can look at them to try to understand what you're thinking. It's a way of you telling me a story, because I understand it's difficult for some patients to speak anatomy or discuss different shapes. There's so many different terminologies. But yes, please bring your pictures. But you have to know that the anatomy and the distribution of fat and the height and the bone structure is different for every different person that comes as a patient. So it gives me a general idea, but there's no rubber stamp. Everybody's an individual, and I pride myself on listening to the patient, seeing what they need. So if your form of communication is going to be a picture, by all means bring it. And then we try to tailor it to you, the patient, and figure out how we can get you into harmony again. But yes, for sure, bring pictures.
We have a question here that says, I have gained some weight and now I look too exaggerated. I had a BBL 3 years ago. What can I do?
Okay, so how much weight did you gain? Do you think you can go back into the gym and work it out? Because gradual weight loss that's done by diet and proper exercise without using drugs or injectables or anything like that will allow you to have enough time to restore yourself to that post-operative result that I gave you without damaging the skin. Because when you lose weight drastically, whether it's by pills or gastric bypass, gastric sleeve, your body reacts better. That gradual weight loss that's not very drastic will help you. So I think try to see if you can go work out instead of having to resort to another procedure.
Of course. So we have a question here that says, do you do lipo on the abdomen if there is fibrosis?
Yeah, no, we do. It's not a no. It's just sometimes I cannot know how the texture of that, the quality of that fat is going to be. Like I was describing earlier, there's fat. I agree with you guys that there's fat that comes back, and not comes back, but you can gain weight. But what happens is there's a lot of scarring. It's like the fat is surrounded by scar, and it can come in my way. It prevents me from working smoothly compared to a case that has not been touched. So what I do is I have access to Vaser Lipo. Vaser Lipo, guys, is a ultrasound assisted. So the ultrasonic energy, the vibration that you guys don't hear at the level of the range of ultrasonic energy, can help disrupt the fibrosis a little bit. And to be honest with you, there are certain cases where I try and I cannot, and this is a discussion I will have with the patient before we start. If you have severe fibrosis and I can feel the skin really matted down to the muscle and I cannot access that area, I'll tell you before that I will try, but the idea is not to damage the skin. We try to access from different areas. Sometimes you don't access from the same area, you go above it or from a different vantage point to see if you can get into some area that allows you to liposuction, and we try. But my goal is not to hurt the patient. So if I think that an area is not accessible, I will not push the envelope to the point where we can get skin necrosis, guys. So we can talk about it in person. I try my best to break up the fibrosis, to resurface it so that you can maybe feel better, and with more attention to massages you can improve it.
We have a comment here that says, my results are resulting. I appreciate you so much.
Thank you. That's good. I mean, this makes me feel better, and you know, it's good to hear this feedback, because you know what, it gives you that confidence, despite my experience, to keep on hearing reinforced positive feedback.
We have a question here that says, does C-section scarring cause difficulty with getting lipo?
No. When you have a C-section scar, and if it's caved in and it's touching the fascia that covers the muscle, I used a special instrument to separate that area, and lipo around it, so that it's at the same level as what's the skin above it and the skin below it, and try to see if I can mobilize that scar and not have it so delineated that it's so obvious.
We have a question here that says, how does I believe they said prep, but I believe they meant pre-op. How does the pre-op operative testing go?
The pre-op testing go.
Yeah. Like what kind of tests? I guess
Okay.
they're asking what kind of tests.
So we ask for a complete blood count. We ask for a complete metabolic panel, your clotting panel to know how your blood clots. We ask for your thyroid panel to see if your thyroid is okay. We look at your glucose over called hemoglobin A1C. We look at you with EKG, chest X-ray. If there's any ultrasounds or mammograms or CT scans, we order all that. That is all given to you after you go ahead and sign up with us. There's going to be a preliminary email that goes to you and has a lot of instructions. And I know it's hard to read through a lot of that stuff, but please try your best because it's for your best interest and it gives you a lot of information about the process. And we also have a department called the pre-operative department, and that is completely there for you to guide you through the process. They'll send you the prescriptions to go get your pre-op clearance from a physician in your local area. And if there's any specialty consultations like cardiology, nephrology, and so on and so forth, they will guide you through that.
So we have a question here that says, do you perform HD lipo?
High definition lipo, yes. I have to say something. All my lipo is high definition. Okay, you guys can tell there's such an improvement. Now, sometimes people, I think, take it a step further, and they're talking about where you show off the lines where the muscle, the abdominal muscles, kind of show through the skin. And yeah, that's called that's more kind of etching, and that is something we do as well. I do as well, and that is where people are, they're really, active. They work out a lot, and they're closer to their ideal body weight. But yes, all my lipo is high definition because you got to create harmony from the armpits all the way down to the waist.
Great. So we have a comment here that says, yay, so excited to see you on the 28th of this month. So excited.
All right. Looking forward to seeing you.
So we have a question here that says, same with that question about those tests. Are they all done again the day prior to surgery as well, or less tests?
No, we don't repeat them. We try to get you guys to get your labs 2 weeks or so before surgery because the labs are good for 30 days. So we try to get you guys to do all that at your PCP where you're going to get your clearance before you come back to Miami, before you come down to Miami, in anticipation to make sure that if there's anything that's not ideal, we either tell you to take like iron supplements to raise your hemoglobin or get further testing to make sure that you're okay. So no, we would really not like to wait to the last minute and do it here. In certain circumstances where maybe the labs have expired or there's any question, we have the ability to draw blood here and send it to the lab, but ideally it should be done in your hometown with your PCP for your clearance.
So we have a question here that says, do you offer post-op IV drops in the clinic?
Yeah, we can. Yes, we can. We can do IV hydration in the clinic. We can do the vitamin IV bag the next day you come here. For sure, yes, we do have that option.
Great. So we have a question here that says, can you lipo laterals upper hips?
Yes, we can definitely do that.
We have another question here that says, some patients have tight skin. How do we know if we are a good candidate for BBL and our skin will expand for good results?
Okay, so that is actually a very good question. Some people have very good skin, very elastic skin, and that will help them in the areas where we remove fat. The skin will snap back, and it's amazing to see them the next morning like a rubber band, like magic happen. And in terms of the butt, I like that question because yes, sometimes the skin is so elastic and so tight, it's hard to expand. And the muscle is big, and the space between the muscle and the skin where we insert the fat is not that thick. So yes, that's when you have to communicate with the patient and be clear with them that you might be a candidate for a second round. And you say that at the get-go, initially, before they go to sleep for their first BBL, and there's no surprises. The patient is alert to the limitations because it's not a balloon that I can keep on inflating. There's going to come a point where I cannot insert more fat. The skin has a certain elasticity, and after that point, it's going to stop. So we try to get that message across to the patient from early on. Now, I've been pleasantly surprised. I've gone in on patients, and while I'm doing the lipo, and re-injecting the fat into the buttocks, it relaxes a little bit more than I thought. Sometimes it's not how much fat you add to the buttocks that makes it look good. Remember, it's what you take away from the areas in the torso and the love handles that makes you look better and makes your buttocks look more obvious. And then strategically adding to the hip dips and the projection is what makes that ratio much better. So the waist is tighter and the buttocks looks bigger, but it doesn't necessarily mean that you have to put thousands and thousands of cc's in there. It's a good lipo addressing the love handles, the bra roll, making sure the flanks are in harmony. That really makes a difference. So, first you need to communicate with the patient. So you need to let them know how good their skin is, and that's a blessing, And then wait for the result of the first case, and if you feel like you want more, then you already have it in your head that Dr. Garani or your surgeon out there said, hey, you might need a second round. So it's not a surprise. Communication, I think, is key.
Great. We have a question here that says, after a consult, how soon after can you get an appointment to get the procedure done?
So if you're talking about a consult in person, or an online consult or a virtual consult, which we have started doing on FaceTime, it all depends on the schedule. It depends on your schedule, it depends on my schedule. Look, our schedules are dynamic. We have, thank God, we have enough patients coming through that I'm busy enough. But you know how it is. Life comes in the way. We have cancellations. So always stay well connected to your pre-op coordinator, and she will be able to guide you. So if you want to let them know, hey, I want to do it as soon as possible, then we look around and see if we can kind of come close to the date that you're thinking of. All right?
We have a question here that says, when do you recommend tummy tucks?
Okay, so the tummy tuck is a procedure for removing excess skin. So when you have a lot of laxity above the belly button and a lot of laxity below the belly button, that's when a tummy tuck comes into effect. It removes excess skin. It just does not give you shape. So when do I recommend it? Is when you have skin that has gone beyond the elastic limit, has a lot of stretch marks, when you have a pannus, and I don't think that lipo is going to do it by itself. Now, I am known for doing a liposuction where I know the patient needs a tummy tuck, but we go ahead and do a liposuction plus or minus a BBL. That's not necessarily the point. The liposuction gives the patient such an improvement in shape because we're debulking, we're removing fat, that the love handles are gone, the bra rolls are improved, the abdomen is flatter. Yeah, they have that skin in the middle that they can manage for about 6 months to 9 months, and then they would come back for a tummy tuck. Why don't, in certain cases, I go straight for the tummy tuck is because I don't think that the patient's going to be happy. They're going to still be square, they're going to still have their love handles. It's not going to impact their overall well-being. And I've seen time and time again from patients that didn't want the tummy tuck and just went for a lipo. You kind of learn from every patient, and there's a lot of patients that just are more, they're going to be more gratified if they have a better contour. And the contour comes by sucking fat out. And yes, as long as you discuss with the patient, hey, your skin is not going to snap back as much as you think, always, there's always going to be a good amount of shrinkage, and patients are pleasantly happy with that and surprised, and so am I. And then you take it from there and you let them heal, and sometimes the amount of skin that you have to remove is reduced. Now that comes at a price that you have to live with a little bit extra skin for a while. And I've had the whole spectrum. I've had patients where the skin went to a point where they're happy, and I've had patients where they call me out in a few months, hey doc, I'm ready, but guess what? I'm happy with my shape. I can see a waist, I can see my flanks, and I can see an hourglass. I have that little skin in the front, but I don't care. I'm coming back. So that's my thought process with tummy tucks and lipo.
We have a question here that says, Dr. Gurani, when can I start working out if I had a BBL in November with you?
Okay, so 3 months. So you had November, so December, January, February. So finish February, and as you go into March, go back into the gym and be careful. Just take it easy. Don't go back to what you did before. Just gradually build up. You've been away from it for 3 to 4 months, so you really have to reduce the amount of weight that you are pushing or pulling, and start with rubber bands, start with body weight, and work yourself up. More repetitions, less weight. And then as a month or a month and a half goes by, then you start stepping it up so that you don't injure yourself.
So we have one of the last couple questions here that say, got my surgery back in June and absolutely love my results. As I come up on 1 year, would you say these are my final results
Absolutely.
right now, doctor?
Yes, what you see right now is what you get.
Great. So we have another question here that says, I have my surgery coming up in May for tummy tuck. How long would I need to stay in Miami after my surgery?
Okay, so for a tummy tuck, I really recommend you stay at least 10 days after surgery, so that we can manage your drains, we can take care of you to the point when you can go home and take care of yourself.
Yes, of course. So
Do we have any more questions?
we just have comments saying that you're the best
Oh,
doctor,
thank
and that they
you.
want to do a virtual consult. We do virtual consults,
Yes.
you guys. So if you're outside of the country, outside of the state, no worries. Here, Dr. Gurani can do a virtual consult with you guys. Okay.
So send us a message and let us know that you're interested in a virtual consult. What is your preferred number and your preferred time? And we'll try to work with my schedule, and my assistant here in the clinic will coordinate a time with you. She will call you before I'm available, get some information from you, so that when I get on the phone, then it's efficient.
So we have the last question
Sure.
here, doctor. I'm getting my surgery with you. How much do I need to weigh? I'm getting my weight up. At how many pounds do you want me to be?
Okay. Well, without your pictures, without your height and weight, I can't tell you. I generally do not recommend weight gain. I'm really pretty much against that. I really want you to just, if you're really above your ideal weight, then try to reduce as much as you can. But the best thing to do is DM me and let me have pictures, the front, the sides, and the back, and give me your height and weight. And give me your date of surgery, and I'll be able to give you advice. But I rarely ever ask a patient to gain weight, because I think that is unnatural, and it's not gonna last after surgery, because you're always gonna stay around where your body is used to.
Great.
Okay.
Yes, great. So thank you so much, Dr.
Thank you.
Gurani. Thank you guys so much for all the questions that we didn't get to. No worries, you guys. You can DM us. You can get in contact with us. You can get in contact through Dr. Gurani's main page, so that way he can answer your questions that we maybe didn't get to. Okay, you guys? Thank you so much for joining the live today. I hope you guys are having a lovely day. Thank you, Doctor.
Thank you
once
so
again.
much. I appreciate it. Thank you for all the good questions, and keep them coming. We'll see you in the next one.
We'll see you in the next one. Bye.